Well, hello and welcome back to Faith-Based Birthing. And we are with Dr. Angela today. I'm so excited. Thank you so much for being here again. And we're going to talk pelvic floor. So I know that last time when we started talking about like, when does a mom actually need to come and see you? And you said from the start. So how does that make a difference? What are some things that seeing a pelvic floor therapist from the get-go can help turn around or make smoother during pregnancy?
So when you're pregnant, there's a lot of changes that are happening. There's hormonal changes, your belly is getting bigger. And so then your posture can change. And so seeing a pelvic floor physical therapist can be helpful in managing the pains that might go with that, the tightnesses and the managing the tension through the muscles. But then also what people don't realize is that the pelvic floor can actually tense up during pregnancy because of all those changes, because of the extra weight being placed on the pelvic floor. So the pelvic floor, pelvis model here. So for reference, pubic bone is in the front, sit bones are on the bottom, and then tailbone in the back. So it forms this diamond that you sit on of muscles, superficial layer. There's a deeper layer here in the inside of the pelvis. So with all of that extra weight of baby, the pelvic floor has to work harder. And so we actually want to help calm those muscles down, because any muscle tension is going to pull. This model doesn't move, but ours does. And so it will pull. And so then we can get that nagging like SI joint pain or pubic symphysis pain. The other thing beyond just the pelvic floor muscles themselves with the weight of baby, there's that traditional pregnancy posture, which I feel like I've mastered at mimicking with working with clients. So you have that, like, you know, you're here and then your bottom's tucked and you're just like thrusting baby forward, kind of hanging into that baby weight.
Doing the waddle. You're doing the
waddle, all of the things that, you know, might happen, but you could like manage if you were aware of them. And so the pelvic floor muscles, there's one thing that I don't know if I mentioned it last time, but so here, here it's called a muscle. It's called your obturator internus. The name of it doesn't matter, but what does matter is that it's helpful to see that, because that's a hip muscle. That's a hip rotator muscle. And so what you can see is that it's closely tied to the pelvic floor muscles. And so they impact each other. And so when you're in that traditional pregnancy posture, or you're doing that pregnancy waddle, that changes the muscles you use around your hips. And so then the pelvic floor might have to work harder again, because it also stabilizes the pelvis. And so if the big butt muscles on the outside are not in a position to work, then these guys have to work harder. And then that extra tension, it doesn't feel great. Like, it can make it feel heavy. You might have some of that heaviness, and that can just be because the pelvic floor muscles are working too hard. Imagine if you were like flexing your bicep for 3 hours, like your arm would be heavy afterwards. And so sometimes that heaviness, that what moms talk about, like in pregnancy or postpartum too, is just that the pelvic floor muscles are too tense and they need to calm down. And so doing Kegels in that way is not going to, it could make your problems worse, basically.
Awesome. So that's what I was going to say, is that's one of the things that I hear a lot is, oh, I'm doing my Kegels, right? Mm-hmm. And so can we talk about that a little bit?
Yeah. I mean, so that's probably the thing I get people tell me the most, like when they walk in my door. It's like, do you know why you're here? And they're like, yeah, I do Kegels. I've been told to do Kegels. I'm like, okay, let's stop. Let's stop doing those. And then, you know, sometimes they'll say, oh yeah, I do them on the toilet. And I'm like, definitely don't do that. Yeah, definitely don't do that. That confuses the signals and can make urinary retention. So we don't want to do that. If you're doing that, don't do that. So the pelvic floor muscles, we always want to work on calming the muscles first. So I've already kind of talked about why the pelvic floor muscles might be tense. That's only a couple reasons why. There's a whole host that we could get into. But we always want to calm down muscle tension first. And then the problems might just be self-resolving. It's kind of like, so if you were to do Kegels and you didn't address the pelvic floor tension, muscle tension first, it'd be like your bicep being flexed and be like, okay, let's like do more things. Like it's not going to feel good and it's not going to do anything. Instead, it can cause like maybe elbow pain or shoulder pain or, other things. And so the same way, we want to calm our pelvic floor first. This is your pelvic floor. So I use my hands like whatever kind of talker that is with my hand. So we want to work to calm the pelvic floor muscles first, just like anywhere else in the body. And so we do that with breathing. And so that is a lot of what I do with people. Other things too, but during pregnancy is I'll teach them how to, if you want to say like reverse Kegel. So you would learn to lengthen your pelvic floor, and it doesn't just stay long. It doesn't just stay, it will rebound back. But the idea is that we want it to have a good resting tone to be able to do all the different motions, to be able to contract, but also be able to relax, because both pieces are equally important. So we need to,
yeah. So, so you go to your OB and you say like, oh my goodness, I'm having horrible pain here. And he goes, oh, that's probably girdle pain, or that's, probably,
round ligament pain.
Yeah. Whatever. SPD, I hear a lot of women say, oh, my birth was so hard because da, 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 da. And that's usually in the conversation. So can we talk about that a little bit and understand what that is?
About what SPD pain is?
Yes.
Yeah. So SPD pain this is your pubic symphysis. So it just means that there's like, it's like too hypermobile, or maybe one side's pulling. Basically, it just means there's pain here. It doesn't quite matter why, but there's pain here. And so what I tell my ladies when they're pregnant is that we are just managing your pain at this point. Like we're not just managing it, but we are working around it. So you have all these different factors. You have maybe baby is positioned weird, so there's more pressure on one side versus the other. Baby kicks, or maybe you kind of step goofy or whatever, but you have more ligament laxity because of the hormones. And so it's just kind of meeting your body where it's at. And so the reason for the pubic symphysis pain matters, but it doesn't matter because the way you address it is kind of all the same. It's just creating that balance again within the pelvis. And so doing things like reverse Kegeling. So I have ideas of how I teach people different breathing strategies. I put them in positions such as like a happy baby, which gets progressively more difficult the more pregnant you are. But like a happy baby where you're on your back and you are pulling your knees up, make room for baby. And then the words that I'll use with people is, I want you to bring your breath and think you're breathing down around your baby and opening up your pelvis. And so what you want to have happen is when you breathe, this is your respiratory diaphragm, and then this is your pelvic floor. When you inhale, your breath should come down comfortably, and your pelvic floor should also come down or lengthen. And so you want to bring that breath so we're opening. And then that's going to help with that balance within if there's any like tension on one side versus the other. And then also we have like a lot of other muscles too.
Right.
So we have our big, beefy adductor muscles. So that's your inner thigh muscles. And so those form the anchor of your pelvis. And so if those ones, which again, if you're in that traditional pregnancy posture, then those usually get kind of turned off because they're not in a position to work. And so although there's the pregnancy posture, like you've seen it where some people are like, whoa, they're like way into that pregnancy posture. And then some women are like, not as much, and they're still equally as pregnant. And so managing that and knowing how to manage, like before you go way into the pregnancy posture, you don't want to just like hang into all of that baby. because that's going to lock things down. It's going to lock down your thoracic spine, which makes it hard for you to breathe in the back, which you need to do to use your diaphragm to pair with your pelvic floor. So these are all things that I go through with people. So this might be ways that you would go see an expert or a pelvic floor physical therapist. But it's managing the muscle imbalance that's happening in pregnancy so that you go into labor the best if you're in pain, it's going to be very difficult to manage what you're doing because you're in pain, and that doesn't, it's not great. And then also if you're in pain during pregnancy, you're probably not going to be as active, which you need to be able to be active to have a healthy pregnancy. And so unfortunately, this information, like we're the experts in this. And so the doctors aren't. And so they don't always even know that this is available or that this should be considered. And so kind of advocating for yourself. I know Minnesota, that's where I'm from. Minnesota, we have direct access. And so, like the place I work, we can just have somebody come in and they don't need a physical therapy referral. And so that might be available to you. You might be able to go around the OB and just say, I'm just going to go see somebody myself.
Yeah. That's so what I say all the time to women is your OB is not a lactation consultant. Your OB is, unless they are which is rare. Your OB is not a pelvic floor therapist. Your OB is not they're your OB. They have a specialty there,
They're really good at getting these out, and they're really good at knowing what's wrong with your uterus.
Yeah.
I'm not that person.
Yeah. But, there are other people that you need to go to get guidance on other parts of your journey. And like I said, I didn't even find out about pelvic floor until, a couple of years ago when somebody said, my bladder just fell out. And I was like, what? What are we talking about?
There's people to help with that and people to help prevent that. Yeah. So, because it is somewhat preventable. So, I think, yes.
No, go ahead.
Oh, I was just going to touch on the going into childbirth, why, if your pelvic floor is tense, if there's tension there, it's going to be really hard to get a baby out. And so that can increase your risk of tearing. And so you want to, that's why you want to address it in pregnancy and be able to connect with your pelvic floor. Cause you need to be able to do that. Well, you should be able to do that, to help yourself have your baby. Cause it's actually your uterus contracts and your pelvic floor should relax when you have your baby. If you're thinking that you're pushing your baby out, then that's not going to be good for your pelvic floor. And then that can make your postpartum journey a little bit more difficult, right? So because of the tearing or just not even being able to connect with these muscles before. And so now trying to find a muscle that you didn't connect with before is mind boggling usually for people.
Right. So, and I know that you mentioned too, one of the things on your journey that you mentioned was sciatic pain and that kind of stuff. Yeah. And so, that is something that you help manage as well. So, can we talk a little bit about that real quick? Just what it is and how you the signs of it and how you can help manage that.
Yeah. So sciatic pain is that those sharp zingers. So this is your side butt. Okay. Just for reference, side view. And so it's those sharp zingers that you might get down your leg or, just in your butt. They can go all the way down to your feet. When I was pregnant with, Abram, so he's my firstborn, I was a physical therapist, but I was not a pelvic floor PT at that time. And I had a combination of pubic symphysis pain and that sciatic pain where some evenings, and my job is pretty active, I'm moving limbs and on my feet. And so sometimes I would get up from the couch and my leg would go, it would give out. I was I can't actually walk right now. So I'm just going to sit here. And not fun, just excruciating pain and just like comes on like a lightning bolt, So I had kind of a combination of both things. And so what the sciatic nerve pain is that you have this big, it's called your sciatic nerve, and it can be presented in a few different ways to people, like the piriformis that's on the outside. And so your piriformis is like from your femur to like your sacrum. Okay. This is your piriformis right now. And so the sciatic nerve either sits in between it, underneath it, or like in the obturator. So the obturator that I showed you before, the obturator internus and the piriformis are in the same group of muscles. And so when those muscles get angry, they can pinch on that sciatic nerve. So those muscles, sorry, I'm going like deep dive here.
What makes them angry? Let's talk about
pregnancy posture, the pregnancy posture. Okay. And that's why you need to manage it. So those muscles externally rotate your legs. So that's that bottom tucked position, knees splayed, waddle position that people will go into. Can you picture that?
Yeah.
Okay. So that position, that bottom tucked, you're using the smaller muscles. These are significantly smaller muscles than like your big butt muscles and your adductor muscles on the inside of your inner thigh. So when you're using smaller muscles to do big jobs, that's a problem. And so that muscle can tense up, pinch on that sciatic nerve, and then you have real problems. And so you need to learn how to like open that up and open up that muscle. So putting yourself in different positions, managing muscle imbalance around the pelvis. So that's like what I'll help people with, and learning how to, although it's hard, working to not go deep into that pregnancy posture, not that deep dive into the pregnancy waddle. The last week of pregnancy, it probably, you maybe can't, if baby's like in your pelvis, like that's really hard. But if you're starting to do that at like week 29, that's like that's not going to be good for you.
Yeah. So the key learning today is avoid the typical pregnancy posture.
Oh, yeah.
learn how to manage that properly, right?
Yeah.
That's my key takeaway. Anyway.
Yeah. I think one thing that might be like an aha moment for people is if I explain it. So what I'm going to say next is confusing, but I'm going to make it not confusing. So muscles work around the joint position they're put in. So that sounds confusing. But what that means is like your bicep. If you were going to use your bicep, or I told my toddler to make a muscle, like he's going to do this. Like this is how this muscle is strongest. With your elbow bent, your bicep is strongest. I think everybody knows that. And so if I were to have my arm out straight, I'm not using my bicep, I'm using other muscles. And so that's why posture matters. And so that's why not doing that pregnancy posture as much as you can and not doing that pregnancy waddle matters, because you are physically not putting your muscles in a position where they can work correctly. So you're going to end up overusing your obturator internus and your piriformis, and you're not going to be using your big booty side muscles or your inner thigh muscles. And so I kind of break down like the butt muscles into two groups. You have your deep butt. And so that's like the piriformis, the obturator internus, that is going to get you in trouble. And that's the butt grippers, the people that look like they have like that. I mean, I look at people's butts because I can see what muscles you're using. If you have that bottom tucked position, you looks like you have a wedgie butt, like you're gripping your butt and you're using those deep hip rotators, versus if you have a nice plump butt, then you are using your side butt muscles. And those are the ones that we want working. But that's why we want to manage that pregnancy posture.
Awesome. Well, thank you. You are a plethora of information and I love it. I'm so glad you're part of this community. It's amazing. And I hope that women are learning a ton of stuff from this. And so for those if you guys have questions for her, we're going to be trying to get her on here, a few times a month, at least, if not every week, if we can, manage that between schedules. But if you have questions, let us know, and we're happy to answer your questions. We'll end up being live a few times and she can answer your questions live as well. But if you do not have a pelvic floor therapist, or you don't know anything about pelvic floor therapy, Google it, research it, find out if there's anybody in your area, or she is online. Like, you can find her. She can help you out. It's amazing. And I love her. So anyway, if you all have specific questions, let us know. And thanks for checking out this video today. And we're going to have lots of other amazing stuff going on in this group. And so give us feedback. Like, was this beneficial for you? You know, we want to know. We want to know what you want to know about your pregnancy and birth journey. So I hope you guys have a fantastic day, and we will see you later. Bye.
Bye.